Hey everyone, and welcome to another deep dive.
Glad to be here.
Today we're going to be talking about something that I think is so important for nursing students and really any healthcare provider.
Oh, absolutely.
Understanding personality development.
That's key.
Because, when you walk into a room, you are meeting someone who is the culmination of, their whole life and all the experiences that they've had.
All those experiences, yeah, and how those experiences have shaped them.
And so we're going to be going over some of the big names in personality development.
Should have heavy hitters.
The heavy hitters exactly like Freud and Sullivan and Erickson and more.
Looking forward to it.
So before we get into the theories and all the stages and all that,
Right.
let's just take a step back and define what we're even talking about here.
Yeah. What is personality?
What is personality? What is this thing that we're trying to understand?
Well, it's a big question, but we can think about it as, it's that unique blend of characteristics. Somebody's temperament, their emotions, their mental processes, and all of that kind of comes together to make someone who they are.
And it influences how they behave,
Yeah.
how they interact with the world, right?
Absolutely. And, I think we often, even if we don't realize it, we kind of have an intuitive sense of people's personalities.
Right. We can kind of tell who's who.
But understanding those underlying dynamics can be so helpful.
Especially in a healthcare setting.
Absolutely. You're going to be dealing with people from all walks of life, each with their own unique personality, and recognizing those patterns can help you anticipate potential challenges. You can tailor your communication to that specific person.
Absolutely.
And just develop care plans that really resonate with that individual.
It's kind of like everyone has their own user manual.
Yeah.
And if you can start to understand what that is, then you can better approach them.
Exactly. You're going to be much more effective in the care that you provide.
So let's jump into it.
Okay.
First up is Freud.
Freud.
Big Daddy Freud.
Yeah. He's the one that everyone has heard of.
Right. He's the one everyone's heard of. And, he can be a little intense.
Yeah. Some of his theories are a little out there.
But he really did lay some important groundwork in understanding personality.
He really kind of set the stage for the field.
Right. So his big idea is that our personality is made up of three parts.
Okay. The id, the ego, and the superego.
Yes. So tell us about these three parts.
Well, the id is like that impulsive part of us.
Yeah.
The pleasure-seeking part. It's like the devil on your shoulder whispering, do it, do it.
Yeah, I know that guy.
Right. We all do. So that's the id. And then we have the ego.
Right.
Which is like the mediator.
Okay.
It's trying to balance those id impulses with the demands of reality.
So it's the voice of reason.
Exactly. It's the voice of reason reminding us that we can't always get what we want when we want it.
And then the superego.
And then the superego.
Is that our conscience?
Yes, our internalized moral compass. It tells us what's right and wrong.
Okay, so we've got the id, the ego, the superego, all kind of battling out.
Yeah, it's a constant internal struggle.
No wonder we're all so messed up.
Right, and Freud believed that how we navigate these conflicts, especially during childhood, shapes our adult personality.
So he was really big on those childhood experiences.
Oh, absolutely. He believed they were fundamental.
Okay, so then he came up with the psychosexual stages.
He did. He proposed that we go through these 5 psychosexual stages: oral, anal, phallic latency, and genital.
And if we get stuck at any of these stages.
Right. If we get fixated because of unresolved conflicts, it can have an impact on us later in life.
So give us an example of what a fixation might look like.
Well, someone who's fixated at the oral stage might be overly dependent on others, always needing reassurance and support.
Okay, interesting.
Well, someone fixated at the anal stage might be really controlling or rigid. Everything has to be just so.
Okay, I can see how that would play out.
Right. So these early experiences can really have a lasting impact.
But I'm still trying to wrap my head around how this helps us as nurses.
Well, it's not about psychoanalyzing every patient, but it's about understanding that their behaviors might be a symptom of something deeper.
Okay, so it's more about having that awareness.
Exactly. It's about seeing the whole person.
I like that, seeing the whole person, not just the illness.
Exactly.
Okay, so Freud, we get it. Childhood matters.
Right.
But let's move on to another big name, Harry Stack Sullivan.
Sullivan. He's fascinating.
What did he bring to the table?
Well, he wasn't so focused on those deep, dark internal drives like Freud.
Okay, so he had a different perspective.
He did. He emphasized the power of relationship.
Relationships, okay.
Interpersonal relationships in shaping who we become.
Yeah.
His theory is all about how we connect with others.
Okay, so it's less about what's going on inside our heads and more about how we relate to the people around us.
Exactly. He believed that our need for connection is fundamental. and that our sense of self develops through those interactions.
Interesting. So he shifted the focus outward,
Precisely.
and he also had stages of development, right?
He outlined 6 stages of development, each highlighting the key interpersonal tasks we need to master.
So let's break those down a bit.
Okay.
What are some of the key milestones in Sullivan's model?
Well, in infancy, it's all about seeking comfort and satisfaction from caregivers, those basic needs being met consistently.
Okay, so that sense of security.
Exactly. And then as we move into childhood, we start to learn about delayed gratification and how to communicate our needs.
Okay, so those early social skills.
Right. And then during the school years, it becomes all about navigating those complex social dynamics of friendships and peer groups.
So fitting in.
Exactly. And Sullivan believed that if we don't develop those healthy interpersonal skills at each stage, it can lead to problems later
No
on,
problems.
like anxiety, loneliness, even mental health issues.
Okay, so this is all starting to sound pretty relevant to nursing.
It is because it highlights the power you have as nurses to create a healing environment
Absolutely.
through those positive relationships.
So we're not just there to give meds and, do procedures.
Right. It's about more than that.
We're there to connect with people.
Exactly. You're often the person that patients spend the most time with, especially in a hospital setting.
Right, we're kind of a constant.
You are. And just being present, listening attentively, showing genuine care can make a world of difference.
Yeah, sometimes just having someone to talk to is huge.
It is. And by fostering those connections, you can help patients develop those crucial skills, manage their anxiety,
Right.
and build a stronger sense of self.
Wow, this is really making me think about the impact we can have as nurses, even beyond the medical care.
It's about recognizing that healing goes beyond just addressing physical needs.
Absolutely. Okay, so we've covered Freud, we've covered Sullivan.
2 giants of the field.
Let's move on to another one. Erik Erikson.
Oh, Erikson, he's the one with the 8 stages, right?
8 stages of psychosocial development,
Yeah, he expanded on some of Freud's ideas.
but he shifted the focus a bit.
He did. He moved away from those sexual drives and focused more on social influences.
Okay, so he was looking at how we develop within the context of society.
Exactly.
Okay, and his big idea is that we face these psychosocial crises throughout our lives.
Yeah. At each stage, there's a challenge that we need to resolve
Okay, so it's like a series of tests we need to pass.
to become well-adjusted individuals.
Okay, I like that analogy. So
Yeah.
let's start with the first stage.
All right, the very first one is trust versus mistrust.
Trust versus mistrust, and that happens during infancy.
Exactly. In that first year of life, babies are completely dependent on their caregivers.
Right.
And if those needs are consistently met, they develop that sense of trust.
So it's about feeling safe and secure in the world.
Exactly. But if their needs are neglected, they may develop mistrust.
And that can make it harder to form healthy attachments later on.
Absolutely, it can have a ripple effect.
So that first year is really crucial.
It lays the foundation for everything that follows.
Wow. Okay. So what about the other stages? Give us a quick rundown.
Okay, well, after trust versus mistrust, we have autonomy versus shame and doubt. Think toddlers asserting their independence,
Right.
followed by initiative versus guilt, where preschoolers are testing boundaries and exploring their world.
And then industry versus inferiority.
Yes, where school-aged kids are comparing themselves to their peers.
Right. Figuring out where they fit in.
Exactly. And then, of course, we have the teenage angst of identity versus role confusion.
Oh, yes. Who am I? What do I want to be?
We've all been there.
Oh, tell me about it. But life doesn't stop after high school.
It certainly doesn't. Young adulthood brings the challenge of intimacy versus isolation, forming those meaningful, lasting bonds.
Okay.
And then generativity versus stagnation, where we focus on contributing to society and leaving our mark on the world.
Okay.
And finally, as we reach our golden years, it's ego integrity versus despair, reflecting on our lives and finding meaning in our experiences.
Wow, what a journey.
It is a journey.
So I'm starting to see how understanding these stages could be really useful for us as nurses.
Oh, absolutely.
By recognizing where a patient might be developmentally, we can better understand their struggles.
And offer support that's tailored to their needs.
Exactly. Meet them where they are.
Precisely.
Okay. This is amazing. I'm really loving how all this is coming together.
It's fascinating, isn't it?
It is. It's like we're getting a glimpse behind the curtain.
To understand what makes people tick.
Okay, so we've covered Freud, Sullivan, Erikson. 3 big theories down.
3 down.
Are you ready for more?
Oh, I'm ready, but I think we need to give our listeners a chance to digest all of this.
I agree. That was a lot of information.
It was. We'll pick up with the rest of our personality theorists in the next part of our deep dive.
Sounds good to me. So until next time, keep those brains buzzing.
And we'll see you back here soon for part 2 of our exploration into the world of personality development.
Welcome back, everyone. Ready for round 2 of our personality deep dive.
I'm excited to learn more.
Great. Well, last time we focused a lot on those big personality theories.
Mm-hmm.
Freud, Sullivan, Erickson.
Yeah, those are some big names. They were giants. But this time I thought we could shift gears a bit.
Okay, I'm intrigued.
And talk about how our early relationships and how we see the world shape who we are.
Okay, so more about those early childhood experiences.
Exactly. And to kick things off, let's talk about Margaret Mahler.
Mahler. Okay, I'm not as familiar with her work.
Well, she's fascinating. She focused on those very early stages of development.
Like infancy.
Exactly. And she highlighted the crucial role of attachment in those early years.
Attachment, that definitely sounds relevant to nursing.
It is. It's all about those early bonds we form with our caregivers.
Usually our mothers, right?
Right, usually mom, but it could be any primary caregiver.
Okay, so how does this attachment thing work?
Well, Mahler's theory is called object relations.
Object relation.
Yeah, and it focuses on how infants develop relationships with these important people in their lives.
So it's about that connection, that bond.
Exactly. It's about how we learn to separate from them, become individuals.
But still maintain a sense of connection.
Right. It's that push and pull we see in kids, that wanting to be close, but also wanting to explore on their own.
Yeah, that dance between dependence and independence.
Exactly. And Mahler outlined 3 key phases in this process.
Okay, 3 phases, hit me with them.
All right, so the first one is the autistic phase.
Autistic phase.
Yeah, it happens in the first month or so of life.
Okay, so brand new babies.
Exactly. And in this phase, babies are pretty much oblivious to the world around them.
They're just kind of in their own little world.
Exactly. They're focused on their own internal sensations, eating, sleeping.
The basics.
The basics, exactly, but then comes the symbiotic phase.
Symbiotic. Okay, that sounds interesting.
This is where infants start to become aware of their mothers as separate beings.
Okay, so they're starting to realize mom is not an extension of them?
Right, but they still experience themselves as being fused with her.
So like one unit.
Exactly, a very close connection.
Okay, and then the third phase.
This is where things get really interesting. It's the separation individuation phase.
Separation, individuation.
Yeah, it starts around 5 months of age.
Okay, so babies are a bit older now, more mobile.
Exactly. And in this phase, they start to physically and emotionally separate from their mothers.
So they're crawling away, exploring their environment.
Exactly. They're developing a sense of themselves as individuals.
I could see how that would be a big step for both the baby and the mom.
It is. It's a delicate balance the child needs to feel secure enough to venture out.
But also knows mom is there if they need her.
Exactly. That's the key.
So what happens if something goes wrong during this phase?
That's a great question, and it's where the clinical implications come in.
Okay, so this is where it gets real.
Mahler believed that disruptions in this separation individuation process can have a big impact on personality development.
Like what kind of disruptions?
Well, if a child doesn't feel safe enough to explore,
Okay.
or if the mother's too anxious or controlling,
Right.
it can lead to difficulties with forming healthy relationships later on.
So this is where those early attachment patterns can contribute to problems later in life.
Exactly. For example, borderline personality disorder,
Yeah.
which is often linked back to disruptions in early attachment.
So as nurses understanding these early childhood dynamics can help us approach patients with more empathy.
Absolutely. It's about seeing the whole person, understanding their story.
Not just focusing on their symptoms.
Exactly.
Okay, Mahler has definitely given us a lot to think about.
She has. She's a pioneer.
Let's move on to another giant in cognitive development, Jean Piaget.
Piaget. He's the one with those stages of how children learn to think.
Yes, the stages. I remember learning about those in school.
Well, he was a brilliant observer of children.
He was.
And his work changed how we understand the development of their minds.
So tell us about these stages.
He proposed that children go through 4 distinct stages: sensoromotor, pre-operational, concrete, operational, and formal operational.
Okay, that's a mouthful. Can we break those down?
Of course, let's start with the sensoromotor stage, from birth to around age 2.
For little babies.
Exactly. During this stage, babies are learning about the world through their senses and motor actions.
So everything goes in their mouths. They're banging objects together.
Exactly. It's all about experiencing the world directly.
They're like little scientists.
I love that analogy. And a key development in this stage is object permanence.
Object permanence, right? That's when they understand that things still exist even when they can't see them.
Exactly. It's a huge cognitive leap.
Yeah, peekaboo wouldn't be nearly as fun without object permanence.
Right, then around age 2, children enter the pre-operational stage.
Pre-operational.
Yeah, which lasts until about age 7, and they begin to use symbols and language.
So this is when we see kids playing pretend.
Exactly, using a banana as a phone or a block as a car.
Their imaginations really take off.
They do, but their thinking is still quite egocentric.
Beanie.
They struggle to see things from other people's perspectives.
Ah, so it's all about them.
Pretty much.
But eventually they grow out of that.
They do. Around age 7, they move into the concrete operational stage.
Concrete operational.
Yep, lasting until about 11. And during this stage, children become more logical.
Okay.
They can think about things in a more concrete way.
So they start to understand concepts like conservation.
Exactly, that the amount of something stays the same, even if its shape changes.
Okay. Oh, remember learning about that.
And they're also able to classify objects and understand basic math concepts.
So their thinking becomes more organized.
Much more. And then finally, we reach the formal operational stage.
Formal operational, the final stage.
Yes, starting around 11 and continuing into adulthood.
Okay, so this is where we are.
This is where abstract thinking kicks in.
Right.
Adolescents can think hypothetically, solve problems systematically, and reason about abstract concepts.
Like justice and fairness.
Exactly. They can think beyond the here and now.
Wow, what a journey from putting things in their mouths to pondering the meaning of life.
It really is. And for you as future nurses,
Yes.
understanding these stages is crucial for communicating effectively with patients of all ages.
Right, you wouldn't explain a procedure to a 5-year-old the same way you would to a teenager.
Exactly. You have to tailor your approach to their level of cognitive development.
It's like having a secret decoder ring for the human mind.
Love that. And speaking of decoding, let's move on to Lawrence Kohlberg.
Kohlberg?
He focused on moral development.
Moral development. Okay, so how we decide what's right and wrong?
Exactly.
Is that something we're born with or do we learn it?
Well, Kohlberg proposed that we go through 3 levels of moral reasoning: pre-conventional, conventional, and post-conventional.
3 levels.
Okay.
I'm ready.
All right. So at the pre-conventional level,
Okay.
morality is all about avoiding punishment and seeking rewards.
So it's very self-centered.
It is. It's that what's in it for me kind of thinking.
Makes sense.
But as we mature, we move into the conventional level.
Okay.
Now, morality becomes more about following rules and social norms.
So we want to fit in, be seen as good.
Exactly. We care about what others think of us.
Peer pressure.
Exactly. We internalize the values of our society.
Okay, but some people go even further.
They reach the post-conventional level.
And what happens there?
At this level, morality is based on universal principles.
Like?
Justice, fairness, human rights.
So it's about doing what's right, even if it goes against the rules.
Exactly. It's about recognizing the inherent worth and dignity of all people.
Wow, that's powerful.
It is.
But how does this apply to nursing?
Well, understanding these different levels of moral reasoning
Okay.
can help you understand your patient's decisions.
Especially when it comes to tough ethical dilemmas.
Exactly.
So, for example, if a patient is refusing a treatment,
Right.
we might understand their reasoning better by considering their stage of moral development.
Exactly. Are they afraid of the consequences? Are they worried about what their family will think?
Or do they have a deeply held belief that's guiding their choice?
It's about understanding their framework.
This is all so fascinating.
It is. It really highlights the complexity of human behavior.
Okay, so we've covered Mahler, Piaget, Kohlberg.
We have 3 more giants down.
My brain is full.
I know we've covered a lot, but there's one more important theorist we need to discuss: Hildegard Peplau.
Peplau. She's a legend in nursing.
She is, and she brings together many of the ideas we've been discussing today.
Okay, I'm intrigued.
But let's save Peplau and her wisdom for the next part of our deep dive.
You're right. We need a little break to process all of this.
Absolutely. We'll see you back here soon for the final part of our personality development adventure.
All right, nursing students, welcome back to our final part of this deep dive into personality development.
I hope you've got your thinking caps on, because we've saved a really important figure for last.
You're really making me sweat it. Who is it?
Well, it's none other than Hildegard Peplau.
Peplau. Oh, wow. That's a huge name in nursing.
She really is a legend, especially in the world of psychiatric nursing.
Okay, so we've been talking about all these different personality theorists, like Freud, Sullivan, Erickson.
Right. A lot of big names and big ideas.
But Peplau was different, right? Her focus wasn't on creating another stage theory.
Right. Exactly. You're right. She wasn't trying to define those developmental milestones like the others.
So what was her contribution to this whole personality development thing?
Well, Peplau took all those interpersonal concepts we've been talking about and applied them directly to nursing practice.
Okay, so bridging the gap between theory and the real world.
Precisely, she focused on the heart of nursing. You know, that nurse-patient relationship.
Oh, I see. So it's about how we interact with our patients.
Exactly. And her model is considered groundbreaking because it shifts the focus from what nurses do to patients to what they do with them.
Okay, so it's more collaborative.
It's a partnership, a real team effort between the nurse and the patient.
So less about giving orders and more about working together.
Exactly. And Peplat really believed that the relationship itself is therapeutic.
The relationship itself.
Yeah, by creating that safe and supportive environment built on trust and mutual respect.
Right, making the patient feel comfortable.
Exactly. Nurses can empower their patients, help them understand their feelings, work through their challenges.
So it's about more than just their physical health.
Absolutely. It's about addressing the whole person, their emotional and mental well-being as well.
And this is where I think Peplat's emphasis on therapeutic communication comes in, right?
It's not just about casual chit-chat. It's a stilled approach.
So there are actual techniques involved.
There are specific techniques that nurses can use to really facilitate self-awareness in their patients.
Okay, so what are some examples of these techniques?
Well, active listening is a big one.
Okay, I've heard of that. What does that look like?
It's about truly being present with the patient,
Right.
really hearing what they're saying, both verbally and non-verbally.
So not just waiting for your turn to talk.
Right. It's about really trying to understand their perspective.
Okay, I can see how that would be powerful.
And it also involves asking open-ended questions.
It's just yes or no question.
Exactly, encouraging the patient to really explore their thoughts and feelings.
So they feel heard and understood.
Exactly, and empathy is another key ingredient.
Empathy, that's a big one.
It is Peplau believed that nurses must be able to put themselves in their patient's shoes.
Really try to feel what they're feeling.
Exactly, and that can be tough sometimes, especially when you're dealing with difficult situations.
But it's so important for building that connection.
It is. If a patient feels like you truly understand them, it builds trust and creates a much stronger bond.
And we've talked about how powerful those bonds can be.
Absolutely. Those connections can really be the catalyst for healing and growth.
It's amazing to see how it all comes together, from these grand theories of personality to these very practical and powerful techniques.
It really highlights the art and science of nursing.
I feel like we've been on an incredible journey these past 3 episodes.
We've explored so many different facets of personality development.
And now we've landed right here at the heart of nursing practice, that one-on-one interaction between the nurse and the patient.
It's all connected.
It really is. So as we wrap up this final part of our deep dive, what's the key takeaway you want our listeners to remember?
Remember that your patients are not just diagnoses or sets of symptoms.
They are people.
They are unique individuals with their own stories and experiences that have shaped who they are.
And by understanding those stories, by really taking the time to see and hear our patients.
That's when we can provide truly compassionate and effective care.
Care that honors their individuality and meets them where they are.
Couldn't have said it better myself.
Well, that's a wrap on our personality development deep dive.
It's been a pleasure.
Until next time, keep those brains buzzing, keep those hearts open, and remember, every patient is a story waiting to be understood.